Hello everybody. So today I'm making this video in order to give an idea about what is MRCS, who should be giving MRCS, and what is the ideal time to give MRCS. I got many of my juniors and colleagues who asked me a few questions regarding MRCS after I cleared it in the last month. So I thought that I'll make a video on it so that all your doubts would be cleared at the first place, and also you'll have a good idea about what MRCS actually is. So my journey to pursue MRCS was more of an emotion rather than practicality. Belonging to a family of doctors, my grandfather and grandmother always wanted me to pursue a degree from Royal College of Surgeons. Actually, I would like to dedicate my degree to them. Sadly and unfortunately, I've lost both of them today. But I'm sure that wherever they would be enjoying seeing me get this degree. MRCS stands for Member of Royal College of Surgeons, and there are 4 colleges who give this diploma or the degree, what you can say, and these are Glasgow, Ireland, England and Edinburgh. So starting off, it is an intercollegiate exam and you can give exam through any of these colleges and still you are going to have the same degree, that is the MRCS. The exam is primarily divided into 2 parts, Part A and Part B. So talking about the Part A is further subdivided into the first and the second part. So you give your Part A exam on a single day, and the day is divided into a morning session and an evening session. A morning session consists of 3 hours which contains 180 questions. So these include all your basic sciences and paramedical sciences like basic anatomy, physiology, pathology, pharmacology, microbiology, whatever is required in the surgery. They won't ask you questions from medicine straight away, but yeah, a medical topic which might be relevant in surgery might be required, like electrolyte imbalances, acid-base balances. So these all things are required. Part A exam, which is in the first half, where you will get a center in a city you register for, and after getting that center, you will go there, you will give that first part of your Part A, and then you will be let free for maybe an hour or two, wherein you get time to have lunch or you get time to relax, and then again the exam starts for the second half of the day. So that is about the first part. Going down to the second part, there is an afternoon session of 2 hours, which is again based on your core surgery principles. So in that, basic general surgery, right from trauma, right from basic gastroenterology, basic urology, basic orthopedics and general surgery. So that is pretty important because as a general surgeon, we fall short of orthopedics or some amount of theoretical part which we might have missed out in our NEET PG exams. So we might not have been so strong in preparing Part A. So that sums up about the Part A exam. My journey was pretty much disappointing for Part B because I gave my first attempt of Part B last year in September, and unfortunately I lost the exam just by 1 mark. So without disheartening, my dad asked me to give the exam again in the next attempt, which I did and cleared pretty well. So what is Part B all about? So there are total number of stations which account to 17 or 18 stations, that depends on the exam time and exam date. These stations are broadly categorized into the knowledge-based stations and your skill and communication-based stations. So knowledge-based stations include maybe 3 sessions from anatomy, 3 sessions from pathology, and 3 sessions or 2 sessions from critical care medicine. So in anatomy, they might have kept some specimens or they might have some photographs of the specimens. They might ask you for the surface anatomy. Then in critical care, what they ask you about is the emergency management of a patient. Like there are a few specified protocols like CRISP protocol. In the surgical pathology part, they are more keen about asking for the malignancies, their mutations, different types of syndromes, men's syndromes, obstructive jaundice. So these are the cases which they primarily ask in the pathology part. So that is about half of the Part B exam. And the other half of the exam which comes to you is skills and communication. So in the skills section, you might be given a task as simple as insertion of the Foley's catheter, insertion of an ICD. Obviously, these are not the real patients, it's a mannequin or a simulator. Or you might be asked to excise a wound and suture it, or excise a lesion and suture it. Then comes your communication part. It is a very important thing to communicate with the patient, which is emphasized in this exam. How you ask for the history is being judged rather than what history is being presented. So the examiner won't judge you on what you are presenting to him. He is going to judge you on how you are talking to the patient, how are you asking his complaints, how are you trying to rule out the negative history. And that is the emphasis which is given, which is not there in our traditional MS exams. So that is one important thing which you are going to have some struggle to while preparing for this exam. Then comes the examination part. There might be CNS examination. There are again patients, or there might be some dummy people who might simulate the condition really well. Like I had got a case of a frontal lobe lesion. I had to check all his brainstem reflexes. So basically cranial nerve examination, CNS examination, then abdominal examination. So these are all things which are included in the Part B exam. So these all stations are mixed up. You might have to give an anatomy station followed by an examination station, which might be again followed by some pathology station or a critical care station, so which are jumbled up. And you have 9 minutes for the station and 2 minutes of the break. So 1 minute you are going to wait outside the room. When the bell rings, you are going to enter the room. And after entering the room, within 9 minutes, you are again coming out. So this is a cumbersome process. Again, the whole day of events and quite a tiresome process. And again, being a general surgeon, the questions might be asked from anywhere. It might be from CNS, it might be from orthopedics, sometimes even OBGY. All types of things are asked. Another emphasis about the communication station is there are a few scenarios. Like I had got a scenario of a patient who was not convinced to undergo surgery because he was on warfarin. So I had to convince him of how we are going to bridge him to heparin. He was still not convinced. He was asking me repeated questions. He was asking me repeated problems which he had. So they emphasize on how patient you are. How are you approaching the patient? How empathy do you have about the patient? So that is what all Part B consists about. So ideal time for giving this exam is preferably when you are pursuing your residency. That is the first part. Why? Because the Part A of the exam corresponds to most of your syllabus of your NEET PG. So giving the exam early would benefit you rather than giving it late. So preferably try to give it as early as possible whenever you enter your surgical residency, and try to clear at least Part A, and then you still have the span of 7 years to clear the Part B exam. So Part B exam is technically more amount of practical skills, more amount of communication skills which you are going to develop in a surgical residency. As a first year or second year resident, you might not be that confident or competent in dealing with patients, which eventually a third year resident would preferably be better at, which happened in my case as well. You're more confident, you're more responsible in managing patients. So I think at least at the end of the second year or the beginning of the third year, or rather I would say third year of your surgical residency, would be the earliest appropriate time to give this exam. Rest said, you can give it anytime after 7 years after clearing your Part A exam. So this question was asked by many, that how did I clear this exam managing my tiresome residency. So first thing is, try to consider this exam as a part of your own syllabus and curriculum rather than considering it as some other exam. You are going to encounter the scenarios which you definitely encounter in your day-to-day basis. If you are pursuing residency from a good college where you have exposure to all types of cases, including trauma, abdomen cases, head neck cases. So as a good general surgeon, it would be easy for you to crack this exam if you are in a good college with good amount of patient load and you're managing the patients pretty well. So that won't be an issue for you to clear. Then the matter comes of when actually to prepare. So preparing an hour or two, at least 4 days a week or 5 days a week is more than sufficient if you are pretty good at what you're doing. What I mean to say is, if you manage a patient of acute appendicitis, you manage a patient of calculus cholecystitis. So these are the case scenarios which are going to come you in the Part B exam. So technically speaking, not much extra work would be needed for you to do because you are dealing with those patients daily. You just have to apply the same thing by reading a couple of hours, maybe 4 days a week, and that would be enough. Same goes for Part A, because most of your knowledge would be fresh as you are past NEET PG. As you have completed the first year of residency, you might have been getting your juniors as well. So after you have your juniors under your hand and many of the things are being delegated to them, that is the appropriate time to start studying. Preparation of 1 to 1.5 months is a decent time. Again, provided that you are having a good clinical exposure. So there are a lot of platforms available. For my part A, I personally preferred eMRCS, which was a decent platform, had a lot of MCQs, and as I said, that if your knowledge is pretty fresh from your NEET PG, you just need to attempt a few questions to just brush up your knowledge. There are a few specific terms which are encountered predominantly in the exam, like Paget-Stotter's disease, which are not pretty much in our NEET PG syllabus. But having said that, after you solving 50 to 60 MCQs in a couple of hours is not a big deal. You can clear at least 80% of them based on your previous knowledge, and rest 20% you can just grasp, and that would be a new learn from the day. That's all about part A. In part B, exam condition is pretty much important than actual syllabus, because in your OPD you know how to manage a patient of acute abdomen, how to ask questions to patients of acute abdomen, what histories to be elicited, how to take sutures. But the problem comes in that scenario where you're not aware of how you are going to be judged in the exam. So for that, there are a lot of platforms available. There is Mortimer Green, there is IMG Academy. Personally speaking, I did not choose any one of those because my first attempt of the exam itself acted as a mock test for me. So I was pretty aware that how the exam pattern is. So technically speaking, you don't need to have some specific app or specific platform. I've heard a lot good things about them, but again said, it's the pattern of the exam which is going to scare you more than the actual questions or the actual patients. So honestly speaking, getting MRCS from any of the colleges won't bother. It is as good as said that it is intercollegiate exam. May you take from London, may you take from Glasgow or Edinburgh, it is not going to make a lot of difference. And adding to that, you can even change your colleges after passing the exam. So there's a simple process of filling a form and transferring your degree to some other colleges, and you can do it pretty well. You just have to pay the registration amount for that college and you will have the degree transferred to that. So why MRCS? So many would think that if you do MRCS, you might get a corporate tag, or if you do MRCS, it might add to some big achievement. So rather than going to what you can get after MRCS, I would like to emphasize on what you get during MRCS. The first important thing is the thinking strategy, because these people emphasize a lot on these basic medical sciences, anatomy, physiology, which you have missed out after joining the residency. So you are going to learn a lot from the MRCS. Second part is the exam pattern. They emphasize a lot on communication skills. Sadly, it is the truth of the society that we are not judged on how we communicate with the patients, which is a big factor in these days. Because you can see a lot of violence against doctors, but somewhere or the other that communication gap is still present because of a lot of maybe technical stuff, paperwork. We are not that good with communicating things with the patient, explaining the patient in the patient's own terms. Patient might not be aware about scientific terms. So that is the part which MRCS plays a key role in. You have to emphasize on communication. You have to emphasize on how to communicate with the patient. So that is one thing which MRCS is going to give you. The third important thing is self-respect, self-esteem, and obviously confidence in your own self. Just think about clearing this exam before you are giving your MS exams. You yourself feel empowered. You feel that you have something in your hand. You have achieved something in your hand. But it is going to make your thinking strong, make you think responsible, make you feel a bit empowered about your own self. So let's consider that rather than thinking about what you are going to get after clearing the exam, it is pretty important that what you are getting through the process, and that is invaluable, because the emphasis which these people give on is not what we are taught, and vice versa. So it's like having best of both the worlds when you are clearing MRCS. So what after getting MRCS? So after clearing the exam, the world doesn't stop there. You have to pay another hefty amount to the college to get the actual registration. There are two options to it. You might be called there for the felicitation, which is quite a prestigious diploma ceremony. But again, as I said, it's all a matter of what you want. If you feel going there, getting the diploma, getting the degree, maybe with your parents or having it for your own, it is always going to be a good thing. But even not, they'll send you the degree or the diploma to you by home. Even if you're not going to pay to any of the colleges right now, it is not going to bother. You can wait as long as you want, because after clearing the exam, the mark sheet and the certificate itself is a proof that you are eligible to get membership of any of the colleges. So each colleges have their own benefits and perks of registering with them. So you can just get it off, like, some colleges give you journal opportunities, some give you free video series or lecture series or surgery series. So these are quite different aspects of each college, what a college gives. But you have to choose what you want, and then accordingly you can select which college you want to apply your membership for.